Hi, my name is Alea Wood. I'm a senior psychology undergrad researcher. I am a graduating senior psychology major at Dillard University from Vallejo, California. I currently hold the role as president of Dillard University's National Alliance Mental Illness Club. We promote awareness among college students in the community about mental health issues. Our focus is to shed light on social injustice and collectively work towards deconstructing these issues. As of right now, I plan to go to graduate school. While in graduate school, I would like to work as a school teacher. I plan to receive my doctorates in clinical psychology. There are many different careers I can go into with this degree. I know I like to try many different things, so I plan to start off by working in a hospital as a clinical psychologist diagnosing children with special needs. Eventually, I would like to go back to school to learn more about sports psychology and open up my own practice in Los Angeles to work with professional athletes. I have an internship at the Orleans County Sheriff's Office. I shadow licensed mental health professionals within the jail, which allows me to sit in on groups for anger management, music therapy, and substance abuse. I also participate in one-on-one meetings and help take part in the process of intake and discharge. Excuse me. For research, I was a research assistant for one of my professors, Dr. Sean Gibbs. We did a study on mental health care services in New Orleans. In the city of New Orleans, a number of social, cultural, and economic and historical factors have affected the availability and accessibility of mental health services. To assist individuals suffering from mental illness in the city of New Orleans, various agencies, programs, and databases have been implemented to promote easy access to the available mental health services. The study explores the ease of accessing available mental health services through the telephone contact. The telephone was used as the main source of contact in the study to immaculate the experience that potential mental health clients would undergo when trying to find treatment. National, state, and local mental health providers' databases were used to compose a list of mental health agencies in the greater New Orleans area. 127 facilities were identified as mental health treatment agencies. Each agency was contacted by phone and requested to participate in the study by completing a 15-item questionnaire regarding the availability and accessibility of the mental health services. 79% of the agency contacted by phone did not answer or hand an automated voicemail service. Descriptive information regarding the availability and accessibility of mental health services, types of services, treatment population are reported and discussed. This research addresses the disparities between the burden of mental disorders, resources, and accessibility. I'm doing research currently on the food desert in the greater New Orleans area. I've come to notice that there are not many fresh produce stores in certain low-income areas compared to others. In Metairie, they have a Whole Foods and a Trader Joe's within a 5-mile radius, whereas in Gentilly, there would be about 10 corner stores and one grocery store. They have a Walmart and you have to go all the way uptown to go to the Whole Foods. Researchers have said that the lack of vegetables, dairy, and other fresh foods in the neighborhood stores contribute to a poor diet, obesity, and diet-related diseases. Louisiana ranks 5th in the nation for the percentage of obese residents and have the highest rate in the country of deaths from diabetes. I expected to find that New Orleans does need more fresh produce stores. Some people aren't able to afford to travel the distance to go to the fresh produce stores that are out of reach, and this affects our health and the way we live. So I definitely think they should fix that.